Assalamu alaikum everyone. Hope you all are doing well. So we were doing our prosthodontics, in which we were doing removable partial dentures, and we started our different chapters of that. I uploaded around 3 videos of it, and first we covered some basic knowledge. Then we did types of removable partial denture, and then we did Kennedy's classification, and now we are doing different components of removable partial dentures. Okay, in this video we will studying about the different components of removable partial denture. So let's get going. Okay, components of RPD. RPD have 7 components, which include a major connector, minor connector, rest, direct retainer, stabilizing, or reciprocal component. Okay, that is basically a class. Then we have an indirect retainer and a base. Okay, so we have a major connector, a minor connector, denture base, obviously teeth. Then there is a rest, and this is your stabilizing component, rest. Okay, so these are the components of your major connector here. So moving on, no, these were the components of your RPD. Now we will be doing separately these components, okay, starting from major connector. So major connector is a part of a removable partial dentures that join the component from one side of the arch to those on the opposite side. We have obviously we have a mandible and then a maxilla, so there could be we could be making a maxillary RPD or a mandibular RPD. So therefore we have a mandibular major connector or a maxillary major connector. It depends on which arch we are working. Okay, so this is your major connector. See, this whole major connector is connecting of one side of the denture to the other side of the denture, and also this major connector connects all the different small components of the RPD. Okay, requirements of a major connector. The major connector should be biocompatible. It should be providing cross arch stabilization. Okay, that means it should be that means when a person is chewing, okay, from one side, so all the forces should be applied on the other side, okay, or it should be stabilizing both the sides, if in simple layman terms, or in that terms, that the when one is chewing from the one side, all the forces should be applied on the second side. This is called cross arch stabilization. Then the major connector should be vertical, should provide vertical support and protect the associated soft tissues. Provides a mean of obtaining indirect retention where indicated. Major connector should provide a mean of placement of one or more denture bases, promote patient comfort, and should not lodge food accumulation. Okay, the major connector should not be accumulating food. What are the chief functions of a major connector? Basically, it's provide for unification of the major part of the prosthesis. It distribute the loads, okay. Then minimize a torque on an individual teeth. Provide cross arch stabilization. I've explained all these things in the previous slide, okay. Okay, what is the location criteria of a major connector? Major connector should be free from all the movable tissues, okay, so it should not impinge them. Similarly, impingement of gingival tissue should be avoided. Bony and soft tissue prominences should be avoided during placement and removal of major connector. Relief should be provided into areas of possible interferences. Major connector should be located and relieved to prevent to avoid the impingement. Basically, whatever kind of a major connector you are going, you should avoid some most of the soft tissues, okay, or the movable tissues, so that they don't get impinged in them, in the major connector. In the maxillary arch, the border of the major connector should be 6 mm away from the free gingival margin line. Okay, the border of the gingival of major connector should be away from the gingival margin line. That means there should be a gap between 6 mm gap between the gingival margin line of the natural tooth and the major connector. Okay, in the mandibular arch, the border of the major connector should be at least 4 mm away from the gingival margin line. In the mandibular arch, there should be a gap of 4 mm between the gingival margin of the natural tooth and the major connector. In the mandible, it should be 4 mm away, and in the maxilla, it should be 6 mm away. If there is a palatal tori or a prominent median plate, relief should be provided in these areas where is a tori present. Firstly, you should avoid these areas where is a tori present or a median plate. But if you don't have any other option and you are going for these areas, then you should provide relief in these areas. The anterior border of the palatal plate should be located as far as possible posteriorly to avoid the interference with the tongue in the area of rogi. Okay, the anterior border of the palatal plate, the part which is coming anteriorly in front of your teeth, you should try to place it as behind, okay, as posteriorly to your teeth as you can, so that it doesn't interfere with your movement of the tongue. Okay, the posterior limitation of the maxillary major connector should be just anterior to the vibrating line. From your in your maxillary major connector, when you are placing making it, the anterior border of the your major connector should be placed in such a position where it doesn't interfere with the tongue, and the posterior border of the major connector should be just anterior to the vibrating line, not on the vibrating line but anterior to the vibrating line. Okay. Okay, now design consideration. Some important design consideration for making a major connector are that it should provide structural rigidity to permit broad distribution of applied forces. Okay, occlusal loads transmitted to the abutment teeth and associate soft tissue and underlying bone. ठीक है, the whatever the occlusal load is coming when you are chewing the tooth, when you have like clench your teeth or you have closed your mouth, those occlusal loads should be transmitted where? To the abutment teeth. Why? Because from the abutment teeth you are taking support, and to the soft tissue and underlying, because these three areas of your mouth are where from you take a support. Okay, so third point is other components are effective only when a major connector is rigid, so therefore your major connector should be rigid for a successful RPD. Flexible major connector may cause a serious damage to the soft tissues. Obviously, that's really straightforward. It should not impinge as marginal gingiva is highly vascular and susceptible to injury from sustained pressure. It's also straightforward that your gingiva is highly vascular. Okay, there's a lot of blood supply there, and if a lot of pressure is applied, you can burst those blood vessels, and you can cause an injury there. Okay, or there can be a scrape off injury. It can be any kind of injury, but you should avoid those areas. Okay, borders of the connectors should be round and run parallel to the free gingival margin, and relief should be provided between the metal and soft tissues. Okay, uh, these are some basic obvious point that you have to know while making a RPD or studying a RPD, because they can be asked in your vivas or in BCQ. So okay, you just have to learn them. Should the major connector should cover no more than the necessary soft tissues, shouldn't be interfering and irritating to the tongue. Okay, promote patient comfort, that's our goal. Okay, here is to promote the patient comfort. um, the major connector should be symmetrical, as symmetrical as possible. Okay, tori should be avoided, as I explained previously, that you have to avoid a tori. Okay, and if you can't avoid a tori, then you obviously are going for that area where a tori is present, so then you have to provide relief to the tori area. Okay, the major connector should have smooth and rounded contours, and adequate rest should be provided. Okay, so these were the some basic uh, design consideration that you have to keep in your mind for major connectors. Okay. Okay. Then you have, obviously you have two like arches. You have a mandibular arch and then the maxillary arch. Okay. So you have some designs for mandibular arch major connector, then you have some different designs for maxillary arch. Okay, so in mandibular arch we have six type of major connectors. We can give six type of different major connectors. There is a lingual bar, okay, that lung runs lingually. Then you have a lingual plate, that also run lingually, but it is in a plate form, flat plate, and lingual bar is a bar form. Then you have a sublingual bar. Then you have a lingual bar with cingulum, okay, that it covers the cingulum of your tooth along with the lower lingual bar, okay. Then you have cingulum bar. Then you have labial bar. These are the six different types of major connector in mandibular arch you can give. We will study each of them separately in the upcoming lecture. Similarly, we have maxillary major connector. Here we also have six different kinds of major connector that we can give. We have single plate strap, then we have a combination palatal strap, then palatal plate type connector. Okay, it is a combination of both of these two. Then you have a U-shaped palatal connector, then single palatal bar, and last this anterior posterior palatal bar. Okay, these are the different six type of connectors. We will also study these as well in the upcoming lectures. Okay, so these were the components, and we have officially started our major connectors, okay, in this video. And we will be doing our firstly mandibular major connectors in the upcoming lecture. Okay, we will starting mandibular major connectors, then we'll move to maxillary major connectors in the next lecture, in the upcoming two lectures. Okay, then the third lecture will be based on a minor connectors, the second component of the RPD. Okay, so that'll be all. Do okay, you have any query or you have any question, do comment down, and like and share my videos as well, and subscribe my channel for more to get a follow up of what I've posted on the YouTube. Okay, and do follow me on Instagram. I go by the name of Dr. Barira Mushtaq. And thank you so much. Allah Hafiz. Take care. Bye bye.